APSHO, which is the Advanced Practitioner Society for Hematology Oncology, partnered with J&J to get a little bit more insight, both from a patient perspective as well as a provider perspective in the treatment of multiple myeloma. So a survey was fielded in collaboration with the Harris Poll, where we surveyed 200 providers. I believe it is about 130 or so nurse practitioners and about 69, 70 physician assistants. Then the patient survey was conducted with 100 patients with multiple myeloma. And overall, the survey was really to get a better insight about any gaps or any needs that are unmet in delivering care from both the advanced practitioner perspective as well as the patient perspective. I was actually one of the clinical consultants on the survey, where I actually help tailor some of that content prior to the survey being sent out. And then I've also taken part in disseminating the results of the survey in conjunction with APSHO and J&J, and have reviewed that data in a previous webinar, as well as we presented at JADPRO Live recently. And we will be having a second webinar to present that data once again, talking about these insights that I think are really valuable and valuable in quantifying and presenting to everyone. I think the survey validated a few things. That it validated that patients find their relationships with advanced practice providers as critical to getting their care. There was a bit of a point on the survey where we identified that there is a bit of a I should say branding issue, where patients were initially unclear in identifying advanced practitioners in the survey, but after some education, they were able to identify advanced providers on their team, particularly nurse practitioners and physician assistants. And once that delineation was made clear, 93% of them said that advanced practitioners are very critical in their care. So that was great to be validated that way. Also, it validated that advanced practitioners are passionate about being more involved in delivering care to multiple myeloma patients. About 80% of surveyed providers said that they would like to learn more and get more information and be better experts at providing care for these patients, particularly at initial diagnosis. About half of the surveyed providers said that they really want to be more involved in reviewing progression of disease and reviewing available treatment options, as well as being able to advocate for patients to be receiving the current standard of care. There is some survey out there showing that the percentage of patients receiving the standard of care can actually vary between community settings versus academic settings or major medical centers. So it was great to see that data. It was great to see the passion from both sides, the appreciation from both sides, and really the desire to just continue to deliver the best care for patients. So that was really good. So I think overall, having that premise will translate itself to improving the delivery of care and improving clinical care overall, now that we are identifying these needs, and hopefully can make some resources available, and we have made some resources available for our providers as well as patients. Part of this survey and part of this overall campaign was actually a development of a website called makeithappenmm.com. I believe that's the link for it. And that is a repository of various resources that are housed in APSHO. are available for both providers and patients to get more resources and education material for multiple myeloma. I think the major challenge really is, a problem of abundance. We're very fortunate in the multiple myeloma space that we are continuously getting therapies approved for delivering treatments to our patients. And I think, yeah, one of the main challenges is keeping up to date. So I think having a resource, a repository of resource to access for both providers and patients is massively important as we move forward in continuing to deliver care for our multiple myeloma patients, treat the underlying disease, and hopefully find a cure someday.